Hi parents and families, my name is Nurse Stephanie and I'm here to educate you on the topic of meningitis. So what is meningitis? It's basically the infection and swelling of the meninges surrounding the brain and the spinal cord. So the membranes that surrounds your brain and spinal cord is called meninges. And so with meningitis, it's basically inflammation of the meninges, and as well as the fluid surrounding that space. So the inflammation from meningitis often triggers symptoms such as headaches, a stiff neck, and fevers. Now, how does one get meningitis? Meningitis is usually caused by a viral infection, but they are also caused by a bacteria, parasites, or fungus. Now, also in addition to that, being around someone who is already infected with meningitis, so someone that is sneezing, coughing, you're sharing personal items, or let's say you are this infected person is contaminating surfaces, and that can potentially lead you to getting infected. Sometimes meningitis improves within a few weeks without treatment, and sometimes it can lead to death. So it often requires quick treatment with antibiotics. So how does the process of this disease work? How does what happens with this disease? So basically what happens is when this bacteria enters this part of the brain, it often triggers an inflammatory response. So this inflammatory response can damage brain tissue, and with that it can disrupt normal neurological function. So we'll get into that later as to what healthcare providers do to detect if it's meningitis. We'll get into that later. But for now, let's kind of move into the signs and symptoms of meningitis. So generally speaking, some signs and symptoms to look out for is fever, having chills, headaches, that stiff neck, vomiting, double vision, if you're noticing you're not focusing well, sensitivity to light, lack of appetite. Specifically in children and infants, you're gonna notice symptoms such as irritability, they're eating less, sleepiness, low energy, slower responses, vomiting again, fever. You're also gonna notice a bulging soft spot on the baby's head. In some cases, before the meningitis symptoms start, one may experience more viral symptoms, so such as a runny nose, body aches, chills, rashes. So that's just something to note. So in terms of diagnostics, so how can a healthcare provider kind of treat meningitis? Or I guess not really treat, but test for it. Doing the neurological exam, so you want to assess for motor function, nerve function. Are they balanced? Are they coordinated? Are they how's their mental status? Are they having any changes in mood or behavior? How's their movement sensory function? Is their speech impaired? Is their hearing impaired? More specific, if the healthcare provider notices any of these impairments, they could further push for a imaging of the brain. That could be a CT scan or an MRI if available. Another way a healthcare provider could diagnose would be taking a sample of that fluid that surrounds your brain and your spinal cord. So taking that cerebrospinal fluid and sending it off for testing. That could also be another way in which a healthcare provider can diagnose, because it would detect that bacteria in that fluid. A healthcare provider might also do throat cultures and throat swabs, nasal swabs to detect if it's a viral cause. So that could be some ways to diagnose. So treatment options. So intravenous antibiotics are usually used to treat bacterial meningitis, and the earlier the treatment is started, then the better the outcome. Some studies have shown that using steroids, specifically dexamethasone in children, can help decrease the swelling, decrease that inflammatory response. And this is less often used in adults and more so in children. Sometimes antiviral medications can be used to help alleviate symptoms of meningitis, viral meningitis. Okay, so ways to prevent, of course, hand washing. We want to make sure that we are all staying safe, wearing a mask in places such as a hospital or in areas where you're noticing that there's an outbreak. Vaccinations play an important role in kind of meningitis prevention. So who should be vaccinated? Healthy children should be immunized. To receive the public health has in terms of our vaccinations at 12 months of age, children can receive the meningococcal vaccine, as well as high-risk individuals, so immunocompromised individuals such as HIV positive individuals, pregnant women, and just travelers to areas with high rates of meningococcal disease. So that is ways of prevention. Now we're going to get into kind of nursing care and priorities for patients with meningitis. Recognizing and assessing signs and symptoms of meningitis is first and foremost a priority. You want to facilitate kind of and initiate and triage this patient, okay, and you want to make sure this patient's getting treatment ASAP. You want to monitor the patient's vital signs and doing that neuro monitoring quite regularly. You want to also administer the antibiotics and check and see if your doctor has ordered any sort of treatments to start. Managing symptoms and providing supportive care such as pain relief and just fluid resuscitation. Collaborating with your healthcare providers and kind of educating patients and keeping them in the loop as to what's being done. If any tests have been ordered, such as a lumbar puncture, and that lumbar puncture is that basically the test that is done to obtain a sample of fluid from the patient to test and diagnose for bacterial meningitis. Also, just kind of implementing infection control measures and preventing that transmission in a healthcare setting. The priority again is just going over signs and symptoms and what to look out for, and just kind of understanding those signs and symptoms. That way it can be diagnosed as soon as possible, and beginning that treatment right after. Thank you all for listening in on my little presentation, and I hope you all were able to take something away from this, and thank you all.